Now, still on COVID, authorities at the Ho Teaching Hospital have closed down the surgical ward for disinfection following a suspected positive case reported among one of the staff. 41 cases have so far been recorded in the whole of the Volta region in the latest number of national figures released by the Ghana Health Service. Correspondent Fred Kwame Asare reports the current situation at the regional hospital has increased anxiety and fear among the staff. Amos Jar joins us on the phone. He is Public Relations Officer for the hospital. Mr. Jar, thanks for joining us. When did the hospital discover that your staff member had been infected, and when was the closure carried out?
Thank you, my brother, and thanks for having me. Good afternoon to your cherished listeners. Like you said, the surgical theater was closed temporarily on Sunday because a staff who works in that department tested positive for COVID-19 through general surveillance because she's, according to our checks, she's not been feeling too well, a bit of sore throat and flu-like symptoms from around the feet of this man. So she came to the facility for treatment, and through general surveillance, they decided to check for COVID, and the results came back and she's positive. So we have to close that department, that side of the surgical theater where she works temporarily. And then so Sunday it was done, and then Monday the place was disinfected. As we speak now, they are cleaning the place up for normal work to resume.
When will normal work resume?
After the cleanup, hopefully by close of day, they should be done with the cleanup.
The patients who would have gone there, where are they being treated? For the moment, we don't have emergency surgeries at hand. All we have are elective. So once they are elective, they can be rescheduled. So we are just hoping that an emergency doesn't come in. But should that happen, we will find alternatives to deal with that, because there are other theaters in the facility where that can be carried out after the patient has been actually examined to know the extent of exposure. That will not happen to any staff. The staff members who worked with this patient, where are they now? How many contacts have you traced?
Yeah, like I said, the surgical theater, they have, in her department, she works with three people. Three people. So those three are on self-quarantine now. Their samples have been taken for testing. Now, there are other members of the surgical department who we can say they are secondary contact. Tomorrow morning, their samples will be taken just to, as a precautionary measure, to know that at least nobody is left out. Because with COVID, even though we are dealing with it, it has a psychological effect as well. So people think that they are exposed. So you need to take them. So the secondary contact, their samples will be taken tomorrow morning. The primary, they have been taken care of, and so they are in self-quarantine now.
Are these secondary contacts also in self-quarantine?
No.
Why not?
In self-quarantine. Come again?
Why not? Why are they not in self-quarantine?
Because secondary contacts are not as dangerous as a primary contact. Even though we are treating them with the same, we are taking them through the same process, because they don't come directly in contact with the person that tested positive, but it's one department. So we are just being precautious.
But they are coming to work still.
Yeah, they are here. They are working.
Mr. Jar, in the Thermofission factory case, 533 people were infected by one person. Surely they were not all primary contacts.
The way in the Pioneer Food Camp, if I may use that word, we are not told whether all the 513 are primary or secondary. We are not told that. But what I'm saying is that we have departments within the unit where each worker is stationed. So the three that are close to where the person works, they have been asked to self-quarantine as their samples were taken. Now the rest, the samples are being taken tomorrow morning, but we don't think they are in a critical moment, or as say they are not primary contact. So work must go on as we and they are even in the ones who are even doing the cleaning. Part of those who are doing the cleaning for services to resume in the facility some time later in the day.
Mr. Jar, thank you very much for joining us.
You're welcome, my brother.